Good evening, doctors. And this is session 4 of the Revise, Refine and Reinforce Mentorship. And this is Dr. Raghu joining with you again. In the first session, we saw strategies, the war room, and the workbook structure and 80-20 method. Then in the second session, we talked about the technique, smart reading, active recall, 5-10-2 method, and layered revision. And in the third session, which I conducted yesterday, we read about the mindset, managing the fear, anxiety, and then burnout, mental fitness protocol. These things we discussed, and today it is little different. Today it is about closing the gap between knowing and growing. What we are going to do today? Today we are going to discuss about closing the gap between what we know and what we need to score in the exam. So knowing art failure inside out does not guarantee you marks, isn't it? You always feel like, isn't it? So when we read something, we are very confident enough. We know that I am very, very, very confident that whatever I am reading, it is like super cool. It is going into my mind. But then when we sit in the exam hall, we tend to forget things. Why? Why do we think like that? And sometimes we think, sir, I read everything for my exam before my internal assessment. But when I wrote everything. But then I didn't fetch the mark. Do you know why, guys? You don't know. The reason is we fail most of the time because of only one reason. Why do you know? We fail because we sometime fail to understand that it is not that all you know, if you write, you will be able to score well. It is not like that. Most of the time, we tend to fail because we most of the time doesn't write what is needed for your exam. We doesn't write what is needed for the exam. Instead, what we do, instead we write the entire stories. At times, all the stories is not needed for the exam. At times, all the stories are not needed for the exam, and that's exactly why we have the today's session. Okay, tonight you are going to walk into the examiner's office and see exactly how they are going to evaluate the thousands of answer sheets which they have. You learn their checklist, shortcuts, and blind spots, and then you write your exam specifically which is required for the checklist. Examiners are not your enemy. The examiners are like your customer. And tonight you're going to learn what is required for your customer and how you're going to satisfy them. Okay, clear. And in the last session, we discussed a few important things. The 4 trap, if you remember, all or nothing, catastrophe, comparison, and ready trap. Then we moved on towards the anxiety protocol. Interrupt, ground for 5, 4, 3, 2, 1, shrink and separate. How many of you followed this and seen? How many of you followed? Can you put in the chat box? Let me see how many of you guys followed the last session. See, mentorship, seeing it is very easy, but following it is very difficult. And I want you guys to follow and see. That's what entirely important, and that's the entire idea behind it. That's the entire idea behind it. Okay, clear? Okay. So if you haven't followed, try following it so that you can manage your burnout. So most of you have a problem is we don't know how to control our anxiety, and that is the main reason why I conducted the last session. And today, what we are going to see is we are going to see how to write answers. How to write answers. Yeah, fine. So, essays, they carry 50 to 60% of your mark, isn't it? So, almost 15 to 100, 15 to 30 marks. 2 essays, if you have, you will be having 30 marks. 15 marks into 2, 30 marks is your exam. You cannot afford to write them like a student because now you need to write like a clinician. You need to write like a examiners. So this is the examiner's checklist. I usually tell this. You should follow a checklist. If you see in my OPD, if you see in my inpatient, if you are my PA intern, if you are any one of you is studying in Amrita, if you're going to ask your seniors, intern batch, they'll be telling for everything he has checklist. This sir is very irritating because I tend to follow a checklist, then we don't forget. Same way here, I am going to give you a checklist. I have sat in the marking room. Here is what examiners actually look when they have to correct 100 essays. They need to correct 100 essays, 100 short notes, and they are not have time to read everything. How do they tell you? First one, definition. If you have, this is a essay, this is how they are going to correct yours. This is what they are going to correct yours. So first thing is crisp definition is needed. So what do you need? You need a crisp definition. For example, if your total marks is going to be 15 marks, 15 marks for your essay. So 1 mark is going to be given for your definition. It should be very crisp. It should be at the top. Then comes etiology and causes. Probably 2 marks they are going to give you for the etiology and causes. So you need to logically group them. You have to show how you think as a clinician. Then comes the pathophysiology. Always remember, when you have a pathophysiology, you need to draw a diagram. You need to draw a diagram. It can be a simple line diagram or sometimes it can be a flow chart, but always try to draw diagrams. This will show you the depth. Okay, if you are going to use diagrams, it is going to show the depth of your understanding, the mechanism of the disease process you are going to mention. Okay, that is going to give you around, probably, okay, it will give you around 5 marks. Okay, already you have got 1 mark for your definition, etiology 2 marks, then 5 marks. Almost 8 marks is given now already. The remaining 7 marks, it is going to be divided for 2 marks for your clinical features, and the remaining 5 marks is going for your management. So don't follow this. This is actually, if you are, it's going to be 30 marks. So don't follow this. So actually, this is how your essays are divided. 1 mark for your definition, etiology 2 marks, pathophysiology and diagram is again 5 marks, and clinical features 2 marks, and management 5 marks. Out of this, if you see, pathophysiology is very important. Clinical features, always I will usually tell to write system wise or severity wise. Okay, so always go system wise or severity wise. It shows how you observe the patient. Then comes your investigations. Usually add investigation. Where what maximum happens is, usually you will be dealing with management, but you tend to forget the investigations because management is including the investigation and treatment. So you need to write how do you investigate it, what are the tests you take. So add that also in investigation, and management always follow stepwise management. So in COPD, you have your gold criteria and all those things. Based on that, always go with stepwise manner because that shows your ability to manage a real patient. And at the end, always write the complications. So complication is very important. So if you take heart failure, what are the complications of heart failure? So you need to write the complication and add a prevention. So your management consists of investigation, treatment, complication, and prevention. All 4 has to be there. Okay, if you miss 2+ boxes in this, you will lose 20 to 30% mark, even though your content is excellent. If you hit all the boxes, all the 5 boxes in this, you will score very easily. Out of 15 marks, 12 marks. Guaranteed 12 out of 15 you will be getting if you follow this, because they don't have time to go through each and every heading, but they will have time to see whether you have written definition, whether you have written etiology and causes, whether you have written pathophysiology, whether you have written clinical features, whether you have written management. This is how they evaluate. So if you are able to understand this process, you will get score at least 12 out of 15. Clear? Okay, clear, right? For example, let's see. If you are going to get fibroid uterus as your exam question. Okay, so this is in your day 13 of your workbook, fibroid uterus. Fibroid uterus is a essay question. So fibroid uterus is an essay question, which mostly you will be dealing it tomorrow, I guess. So according to our topic wise, what we are dealing. So tomorrow mostly you will get this essay. Okay, so in the day 13. So in the fibroid, if that is going to be asked as a question for you, how you are going to manage. Usually what happens, student will start like this. Fibroid uterus is a benign tumor of uterus. It causes bleeding and pain. There are different types. Treatment can be medical or surgical. This is how they structure it. But the problem is, if you write like this, you will get maximum 5 out of 50. 5 out of 15. That's all you will get because you have written definition. You have written the causes. You have written the different types. You have written the medical and surgical management, but there is no structure in it. So why? Because there is no structure. It is vague. Could be any gynecology textbook. It can give you, but how you are understanding it. So how the examiner wants it. So for example, definition. When I go and take definition, fibroid uterus, definition in a benign smooth muscle tumor arising from myometrium, most common pelvic tumor in women of reproductive age group. This clarity, if it is there, it is going to earn you 1 mark. If you're going to write it this clarity, you're going to earn 1 mark. Then comes etiology. Etiology, just don't miss the causes. Group them by logic. For example, etiology of fibroid uterus, hormonal factors. What are the hormonal factors? Estrogen and progesterone. Increased estrogen receptors in the fibroid tissue. Local growth factors like fibroblast growth factor, TGF beta, all these things. So these are the hormonal factors. Then comes the risk factors. What are the risk factors you have? Age, peak of 30 to 50 years, nulliparity, and early menarche, obesity, African descent, higher incidence and early onset occurs in African ethnicity. So all these are the risk factors. When you're going to divide like this, you get 2 marks easily. Okay, now comes the why this is important, because it shows you the mechanism, hormonal versus risk factor. You know that. And similarly, you're not just randomly listing it, you're clinically relevantly listing it. So you will get 2 out of 2 marks in this. 2 out of 2 marks. Then comes the pathophysiology or diagram. So diagram, instantly it is going to get you 2 marks out of 5 marks. If you're going to draw diagram, it is going to fetch you 2 marks. So draw something like this, a line diagram. And then how is your pathophysiology? The remaining 3 marks you're going to get with the pathophysiology. How do you get? So the proposed mechanism, altered myometrial cells, where the growth factors are going to come and it is going to stimulate. Your smooth muscles are going to get proliferated. Estrogen, progesterone sensitivity in your uterus increases. Vascular changes occurs. Neurogenesis occurs. Because of this, fibroid growth is going to be there. If you're going to draw this mechanism as a simple flow chart, as a simple arrow diagram flow chart, fibroid are monoclonal. They arise from a single cell mutation. That is why they keep on growing even if it is not removed. If you're going to mention like this, then you're going to earn 5 out of 5. You're going to earn 5 out of 5, especially if you have a diagram. You have a diagram, you are going to earn 5 out of 5 in this. Then comes the clinical features. So examiner wants you to not list down the all your symptoms or clinical features. What they exactly want is, if a patient is going to walk into your OPD, if a patient is going to walk into your OPD, how you are going to treat that patient. So what they are going to see, whether you are able to treat that patient. That's exactly what they are seeing actually. So how you are going to treat the patient? Tell me, how you are going to treat the patient? Come on, can you tell me how you are going to treat the patient? You're going to treat the patient by what? First, you're going to start with the investigation. So first, what you're going to do? You're going to start with the investigation. Before investigation, what usually happens? So based on the size and location, investigation comes under management. So based on the clinical features, first you're going to look into the size. First, you're going to look into the size. You're going to look into the location. So first one, small asymptomatic fibroid. If it is, often it is discovered incidentally in the ultrasound. There will be no symptom. Then comes a large fibroid or submucosal fibroid. You have some clinical classification, isn't it? According to Figo's classification. I'm not going in depth to it. So that is dealt by gynecologist. So I'm just going to tell you just the brief idea. So if you have a large or submucosal fibroid, so you will have a heavy menstrual bleeding, which is most common symptom. That is going to lead to what? It is going to slowly, when you're going to have excess of blood going on, you will have iron deficiency, anemia, fatigue, dyspnea, and dysmenorrhea will be there. And then when it is going to become further more bigger, you will have some of the pressure symptoms. You will have some of the pressure symptoms. What are the pressure symptoms? If it is going to grow in front, that is going to cause urinary disturbances, urinary frequency increases, urgency will be there, dyspareunia will be there. If it is going to grow behind, constipation, lower abdominal pain, pelvic pain will be there. That is pressure symptom. Reproductively, what happens? Infertility is going to get, recurrent miscarriage is going to be there if it is going to be submucosal. If it is going to be submucosal, recurrent miscarriages can occur. This is going to give you the clinical symptoms. So if you're going to write like this, you will fetch 2 marks again. Okay, so why examiners loves this approach? Because it shows you which location causes what symptom and clinically organized, and it shows you the understanding of the mechanism of bleeding. Now you know all the things. Then comes your management. Before going to management, investigations. What are the investigation you will take? First line, start with CBC. Why? Because you need to assess the anemia. So first one, I'm going to start with the management. So when you're going to ask about me, the management, first is going to be investigation. Always remember, first you need to start with investigation. Investigation, you're going to see CBC to assess the anemia. And transvaginal ultrasound can be taken because that is going to be a gold standard for diagnosis. It clearly shows the number, size, location, whether it's submucosal, intramural, subserosal, everything, 95% sensitivity is there. Then comes your second line. You will go for the transabdominal ultrasound. Too large fibroid, better field of view will be there. Special cases like you will plan for a MRI. Why? When planning myomectomy, shows the exact location of the cavity, and then histosalpingography can be done. Why? To see the tubal pattern, see if infertility is there. What you should not do, biopsy. Why you are not doing biopsy? You should mention that also. You should not do biopsy. Why? Because fibroids are benign. Biopsy increases the risk of malignancy and infection. So why examiners tick this? You know what to do versus first versus special situations. You know what not to do and shows the practical clinical thinking. Then comes the management. This section often accounts for almost your 5 marks. When you want to fetch 5 marks, you're going to divide it into conservative management, medical management, surgical management. What is your conservative management? You want to expected management will be NSAID for dysmenorrhea, iron supplementation for anemia, regular follow up on ultrasound. This you're going to do. Medical management is going to be the first line of symptomatic patient. What you're going to do in the medical management? So medical management, you're going to first go have a combined oral contraceptives. Why do you give oral contraceptive? It reduces your flow by 40 to 50%. What drug? Levonorgestrel IUD can be given. Marina. Why Marina you're giving? Because the gold standard medical treatment reduces bleeding by 80% and improves your dysmenorrhea. Then comes your GnRH agonist. Why do you give GnRH agonist? Because it shrinks your fibroid by 30 to 40%, but expensive, maximum 6 months. Why you are going to stop it? Why do you want to stop it? Because hypogonadism can occur. Non-hormonal methods are there. What is the non-hormonal method? Tranexamic acid can be given. Why do you give tranexamic acid? It reduces bleeding by 40 to 50%. NSAID, mefenamic acid can be given. Why do you give that? It reduces your flow and for pain. And surgical management for submucosal fibroid. If it is submucosal fibroid, hysteroscopic myomectomy can be done. In this method, fertility is preserved and your uterus is preserved. For intramural subserosal fibroids, you need to go for abdominal laparoscopic myomectomy. If you want to preserve the fertility, hysterectomy if fertility is not desired. Newer options, uterine artery embolization is there. Radiological, it preserves the uterus. MRI guided focused ultrasound, it is non-invasive, it is emerging. Why do the examiners like this type of approach? Because it shows you medical is first. And it shows you to choose between fertility wishes. It shows you newer options. A clear hierarchy is there. Medical, conservative, then medical, then surgical. Clear? Then comes the complication and prevention. So complication and iron deficiency, anemia, chronic the infertility, submucosal inlocation, recurrent miscarriage, degeneration. Red degeneration on the pregnancy, it causes pain and fever. Torsion, subserosal pedunculated fibroids. How do you prevent it? No proven measure prevention. Early identification and management is important. Clear? So how did I tell this? I read it during my UG days. How I am telling this now? Because I have read in a systematic manner. This is how you need to go regarding your fibroid uterus. Scattered answer is not expected from you. Clinical, structured, examiner pleasing answer is required. So what is the secret? It is not some very difficult thing. I have just given headings and I have grouped things. What I have did? I have just given headings and I have grouped the thing. I have given headings and I have grouped things. That's all. No, that's easy. No. Okay. Then comes the short notes. Short notes, it is just 30-second template. Short notes look small but carries concentrated marks. Poor short notes will give you 2 to 3 marks only. Okay. So short notes carries 5 marks. If you're not writing it properly, 2 mark, 1 mark only can be given. So what is the examiner's checklist? For example, you get a question, you get a case. First, identify it, what exactly it is. First line is going to be your definition, definitely. Then write the key criteria and features. Then write the significance and management in 2 to 3 lines. Bonus, if you add some tables, diagrams, etc. That will fetch you, diagram will fetch you around 2 marks. The remaining things, whatever you are writing, will fetch you 3 marks, totally 5 marks. If 2 marks you are not going to add, If you're going to give a tables and diagram, that will be fetching you 2 marks for sure. So for example, I'll tell you PCOS. PCOS day 13, tomorrow you're going to read in gynecology. A poor student or the student who doesn't understand the concept, what you will be writing? PCOS is a condition in the ovary having a cyst symptom including irregular periods, hair growth, treatment hormonal. That's all you will be writing. More, however, you can just increase the thing. So this person will get only 1 out of 5. 1 out of 5. So essays are around 10 is right. So you will get 1 out of 5 only. But if you write in the examiner pleasing manner, how you can write? PCOS. PCOS is the most common endocrine disorder of reproductive age women. 8 to 13% prevalence. Heterogeneous syndrome of anovulation, hypergonadism, and polycystic ovary. Okay, so these three are the important. And what is the criteria? You have something called as Rotterdam's criteria. Rotterdam's criteria, what it tells? Oligo and ovulation will be there. Clinical biological hypergonadism like hysterism, acne, alopecia, testosterone level will be more, and androstenedione level will be more, and polycystic ovary will be present in the ultrasound. When you tell it as polycystic ovary, when you have more than 12 follicles per ovary or increased ovarian volume, then only you will be telling it as a polycystic ovary. Correct, right? So what is the clinical and significance and management? Screen for metabolic syndrome. 50% have insulin resistant. First line management, lifestyle modification is a first line management. Pharmacological methods, metformin, OCP and anti-androgen. Fertility key, letrozole more than clomiphene citrate. Okay, that gives you a end of this question. If you write like this, you get 4 out of 10. Okay, this is going to clear the identity. This is going to give you the exact criteria, and management shows you that you know pathophysiology. If you're going to write like this, clear. An example. Let me give you another example. Amenorrhea is there. So amenorrhea is there, primary or secondary amenorrhea. So you need to classify intelligently. Anatomical approach, how it shows. Clinical thinking, how it shows. Give a key differentiation. One diagnostic test that is going to rule out. So definition of amenorrhea. Let's see. Amenorrhea, no menarche by the age of 15 years. For 3 years post breast development. Secondary, absence of menarche for 3 consecutive months in previously menstruating women. Classification, anatomical classification, hypothalamo-pituitary, ovarian, and anatomical or outflow. So quick diagnostic approach, beta HCG, TSH, pelvic ultrasound, FSH, LH. So you're going to write like this, examiner loves because you know the anatomical classification, you know the diagnostic approach systematically, and cover both primary and secondary. Vaginitis, for example, trichomonas, candida. Let's take. So how you are going to write? So first divide according to the infection causes. Then in individual trichomonas vaginalis, what is the cause? What are the clinical features? Copious, frothy, greenish, yellow. Discharge is going to be there in trichomonas vaginalis. Diagnosis, wet mount, motile trophozoites you can see. Treatment, metronidazole 400 mg BD for 7 days, treat the partner. Candida albicans, fungal infection. What will be the clinical features? Curdy white discharge is going to be there. Diagnosis, KOH mount, like you will see pseudo-hyphae. Treatment, fluconazole 150 mg single dose or tropical miconazole or clotrimazole 3 to 7 days. So the key difference here is trichomonas frothy green on strawberry cervix. Metronidazole is your treatment of choice. Candida, curd like white, burning sensation. Fluconazole is the treatment of choice. Why this is going to work? Instantly it is going to differentiate. Examiners loves the differentiation notes. And then practical management will be there. Clear diagnosis is going to be there. So short notes, what you are going to remember is criteria question, fix, yield it, high yielding question like Rotterdam for PCOS, diagnostic criteria for pelvic inflammatory disease, comparative question, trichomonas, candida, primary, secondary amenorrhea. Always start with the identity. Shows that you know the disease, not just a symptom. And use subheadings like definition, feature, management, diagnosis, then management. Then comes the MCQ strategy. Next, we are going to discuss about MCQ strategy because most of the university is going to have the MCQ questions. This MCQ test is going to recognize the pattern. It is not a rote memory. Examiner is very lazy. They reuse the patterns. For example, the most common MCQ pattern, classical triad plus 1 question. Okay, a 30-year-old woman who has come with 6 months of amenorrhea, weight loss of 8 kg, complaints of stress at work. What is the most likely diagnosis? So you have stress, you have weight loss, you have amenorrhea. So if you have these 3 things, okay, stress, weight loss, amenorrhea, then it is hypothalamic pattern. So you see the triad, stress, weight loss, amenorrhea, eliminate PCOS. No weight loss is given. So in the question, if there is no weight loss is given, So I will tell you this question again. So let me see who is going to answer. 30-year-old woman. Okay, 30-year-old woman is coming with a complaint of 6 months amenorrhea. 6 months amenorrhea. Okay, 6 months amenorrhea. Weight loss is there. How much weight loss is there? Weight loss for 8 kg. And there is a stress at work. Okay, so now I'll give you 4 options. You're going to tell me. Option 1, PCOS. Option 2, hypothalamic amenorrhea. Hypothalamic amenorrhea. And third one is Asherman syndrome. Asherman syndrome. And fourth one is going to be premature ovarian insufficiency. So I have 4 options in front of you. Now you're going to tell me. So stress is there, weight loss is there, amenorrhea is there. It's a classic hypothalamic pattern. Now you see the triad: stress, weight loss, amenorrhea. Weight loss is mentioned, but PCOS la weight loss irukadu, weight gain da irukum. Appa PCOS is already ruled out. Then eliminate Asherman syndrome. Why? Because Asherman syndrome will happen only when there is a DNC history. Dilatation and curettage, abortion history. Appa Asherman syndrome is ruled out. Now see this premature ovarian insufficiency. This is the age what I told you, 30 years. Appa premature ovarian insufficiency cannot be the answer. So answer is going to be definitely hypothalamic amenorrhea. Similarly, for example, I'll tell you a second question. Let me see who's going to come on, guys. Answer in the chat box. Only I'm doing it for you guys. You need to answer. I'm also spending my time and doing. That means that I want you guys to answer in the chat box. That will only help you guys. Okay, let me see who's going to answer. A patient comes with secondary amenorrhea. Secondary amenorrhea. So a patient is going to come with secondary amenorrhea. What is going to be the first step of diagnosis? First step of diagnosis. How you will do? So option A, whether it is going to be FSH or LH levels, or you're going to go for serum beta HCG. Third one, you're going to go for the pelvic ultrasound USG. And fourth one, if you're going to go for MRI pelvis. So it's very obvious. So when a patient comes with secondary amenorrhea, first thing to rule out is pregnancy. How do you test the pregnancy? You go for the beta HCG levels. So that is going to be your MCQ. So first step, always rule out the pregnancy and simple causes first. So usually your exam questions will be asked like first step, criteria, triad, idella. Similarly, you have another question. Best versus first versus most important. I want you to remember this. So your MCQ la, where they will make you like error or where they make you go wrong is they use this term best answer first, and then they can ask you like very important or most important. For example, I'll tell you PCOS, patient desiring for fertility. What is the first line? Ovulation inducing agent. So first line they asked. So first line means safest, cheapest, simplest first line. Simplest first line is going to be, for example, I'll give you 4 options. I'll give you clomiphene citrate, letrozole, FSH, and laparoscopic drilling. So laparoscopic drilling will never be a first line of choice. Now you have clomiphene citrate and your letrozole. So more best preferred is letrozole. Why? Because it has a better outcome and few side effects. So best is different, first line is different, most important is different. So MCQ attack, when you're going to do, how do you attack the MCQs? I'm sorry, there is some problem in the so I'm sorry to it. So now coming to the step 1. So what is the step 1? Read questions last sentence first. So most likely diagnosis, best next step, gold standard, underline that. So what is the last thing you just see? Then step 2, scan for the keywords. 10 seconds left. See if you can spot the classical triad answer. Then read the full stem. Now read the full case. First read the last line, then see for keywords, then read the full one. Okay, then eliminate 2 wrong answer. Eliminate 2 wrong answer. That is very, very important. Pick up 2 wrong answer which you feel it is obviously wrong. Then the remaining 2 will be there. Decide between them. Ask which one shows a safer, simpler, cheaper thinking. Like for example, I asked you now, right? PCOS, which is a first line ovulation inducing agent. So think that. And remaining 2, just try to eliminate. So what are some traps which they can keep? So some traps they can keep. What are the traps in either? So first one is a distractor trap. I call it as a distractor trap. What is that? Option A, option B. Both will be off correct. So what they would have told you is which is the more correct one. So what you need to see is which one is more appropriate, more correct. And sometimes examiner tests 2020 to 2023 updates. For example, letrozole preferred over clomiphene. This is changed recently. If you study 2015 textbook or 2015 MCQ, this will be you will pick up a wrong one. Then safer first one. So if two options both work, examiner always prefers a safer one. So medical management before surgical, IV before oral. So like this, okay, IV before oral always wins. Why? Because it gives you immediate treatment. So always go in that way. Okay, then finally today I want to talk about the exam temperament. What is this exam temperament? Exam temperament or panic protocol. I'll call it as exam temperament or panic protocol. What exactly is your panic protocol? What you need to follow when you are panicking? All the above falls if your mind collapses in the exam hall. So night before your exam, how you are going to follow? So you at 6 o'clock. So tomorrow you have medicine paper one. What you are going to do? 6 o'clock 30, you are just going to go for a light revision. What is that light revision? I asked you to prepare a paper, subject wise paper, day wise paper, whatever is important. Criteria list like Rotterdam, Jones criteria, Duke's criteria, Curb 65, all these. And you're going to see only I yield short notes and not long essays. You don't have time for all those things. Clear? Then 7 o'clock, you're going to take your dinner. 7 p.m. you're going to take your dinner and light walk outside. Then 8 o'clock, stop studying. 8 o'clock, stop studying. No more books, no more cramming. This is your brain's final consolidation time. So 8 to 9, what you are doing is write a sentence or two in your note. I have prepared. I am ready. Okay. I have prepared. I am ready. Write it down. Shower. Hear some light music. Go to temple. Go to church. Go to mosque. Prayer. Breathing. Journaling. And then 9:30, sharply sleep. 6 to 7 hours sleep. Not just 3 to 4 hours. 9:30 if you are sleeping. 9:30 to 10:30, 11:30, 12:30, 1:30, 2:30, 3:30, 4:30. Wake up at 4:30 to 5. Then revise all the eye yielding topics like criteria, list, those things you read. Okay, sleep is very important because memory consolidation happens during sleep. A rested brain can beat even a tired brain. Even if he is a topper, even if he has read the entire Alice and entire Bailey and Love, if he is not sleeping, his memory does not consolidate things. Okay, and first 15 minutes in your exam, first 15 minutes when you're going to enter, 20 minutes, first 15 to 20 minutes, when you're going to sit in the examination hall, do not start writing immediately. For 3 minutes, scan the entire question paper. Mark the questions which you are 100% confident. Mark the boundary, borderline ones, which you are okay, which you are not okay. And then note down any surprise topic is there. Allot time strategically. So I will always tell allot time like this. If you are a essay, first essay, so allot for 25 minutes, 20 to 25 minutes. Take for the first essay. Second essay, again 20 to 25 minutes. And 5 minutes in between for your essay. So 1 hour will be over in this. The out of 3 hours, 1 hour you are going to allot it for essays. Then short notes. Short notes, just allot 5 minutes, 3 to 5 minutes each. So that means you will have 6 short notes, I guess. How many short notes you have? Almost 6, isn't it? 6 paisa 30, I guess. 30, 30, 60 or 6 or 8. How many short notes you have? Can you put it in the chat box? Can you guys put it in the chat box? How many short notes you have basically in your exam? How many short notes you have basically in your exam? Can you put it in the chat box? So I think you have around 5 maximum, minimum 5 short notes will be there. So 3 to 5 minutes you take for short notes. And MCQ, I think they will be giving you and collecting you back at the beginning itself, isn't it? So you can write the MCQs maximum 1 minute per MCQ. 1 minute per MCQ is what I will preferably tell you guys. So, and then start with the highest confidence. Okay, don't start with the hardest one. Build momentum and dopamine inside your brain. Gain some psychological advantage. Okay, sir, I can do everything, but suddenly I get panic. I see a essay, my mind is freezed now. I have only 20 minutes now. I want to write 20 minutes like essay, but my mind is freezed. My mind has gone blank for an essay. What to do, sir? Stop. Take 15 seconds. Close your eyes. 3 to slow breath. In 4 times breathe in, 6 times breathe out. Tell yourself this is normal. If you don't know, every student there don't know. Okay, skip the essay. Move on to the easier section. Do short notes if you know easy or second essay, and return to the essay with a fresher brain after 10 to 15 minutes. Don't waste your time. Why this will be working? Each and every time you write something you know will activate your dopamine. Your confidence is rebuilt and your brain unfreezes. You now know how to tackle the hardest essay. Okay, so the examiner's brain is trained to scan in 2 minutes. Okay, like your dense paragraph. So, heart failure, if you have. Heart failure is a clinical condition in which heart is unable to pump the blood adequately. This occurs due to many causes, including hypertension, ischemic heart disease. If you're going to write like this in a dense paragraph pattern, you're going to fail in your exam. Don't write it in a dense paragraph. Don't write it like a dense paragraph. Instead, a good person, how he will write as heart failure. Then comes the definition. In definition, there is a reduction in the to ability of heart to pump blood adequately. This is how he will be writing. Or increase in the filling pressure. Okay, then comes the etiology. IHD, most common hypertension, valvular heart disease. Then pathophysiology or quick diagram. So, a trick is underline the heading. Okay, the best trick I will tell you is always underline. Okay, always underline the headings. How do you do it? I'll just share you guys. Okay, so how do you do it? So, what you need to do basically, you need to underline. So, just remember, what you're going to do is, underline the headings. Underline headings. Okay, then use flowcharts. Use flowcharts, very important. Use flowcharts or arrow. Why do you do this? Because it shows you the thinking process. Then third one, box all the important criteria. Important criteria that makes the examiner to see that it draws the attention of them. And you need to use a clear labeled diagram. So even if it is a rough sketch with labels, it will be beating no diagram. If you're not drawing any diagram, then that will lose you mark. And then use this phases like most important, gold standard, first step, write all these things. Okay, now coming back to the 7-day execution. So 7-day, you're going to think like an examiner. This is the execution protocol today I'm going to give you. So essay precision. So what are you going to do? Pick 2 must-to-know topics from your essay, like gynecology, fibroid uterus, prolapse uterus, carcinoma cervix. Okay, write under 20-minute timer. Keep a 20 minutes timer. Okay, so you're going to keep a 20 minutes timer. After reading it, you're going to keep a 20 minutes diagram. In this, follow 8-minute template. Minute 1, you're going to draw a skeletal or you're going to draw headings. Okay, then comes the minute 2. Minute 2 and 3, you're going to add definition, etiology. 4 to 5, pathophysiology, clinical features, investigation, management, complication or a diagram. So, definition clear arka, tick mark. Etiology and group logically, tick mark. Pathophysiology irka, tick mark. Clinical features, whether it's system wise or specialty wise, severity wise, tick mark. First line management versus specialty, special and investigations, management, tick mark. Stepwise pattern, tick mark. Complication, whether you have mentioned, tick mark. Or a diagram present, tick mark. For each and everything, give 1 mark. For short notes, pick 10 high yielding short notes from your workbook. PCOS, amenorrhea, vaginitis, PID, menopause, HRT, 30 to 40 seconds outline using using this template. Identity, criteria, management. Record yourself like speaking short notes aloud, like train viva or speed. So then you can hear it again and again. So by day 4, you should be able to fire any 5 short notes in 2 to 3 minutes without even thinking. MCQ pattern, same wise, classical triad, first step, comparison, all those things. So target is 70% accuracy you need to have in the MCQs. And then every day, okay, every few days, keep a mini mock. I will start this by next week. So how I will do? I will send you some question papers, a self-prepared question paper, 2 essay, short notes, MCQs. 2 essays, short notes, MCQs. We are going to keep strict timer, no reference allowed. You are not supposed to take your notes, anything. So write it down. And then afternoon, 40 MCQ, non-stop. So, okay, you're going to do. And evening, mark everything, whatever you know. Calculate your score. If you're not scoring 65 plus, see where you are weak. Essay, short note, MCQ one. Then drill that tomorrow. I'll be sending you I'll also send you one document where I will keep you the answer key. You see whether all the answers are given. Then you will be able to understand. Okay, then you will be able to understand. So, by the end of today, what we have discussed is we have tried to make you understand that you learned the examiner's checklist for essays, short notes, core MCQ pattern. You learned to present the answers so examiner can't miss your structure. And between now and March, your job is to not learn new things. You have RRR for that. I am giving you what are the content you need to learn. Your job is to practice executing these frameworks until they become automatic. When you see a question in your examination, all fibroid uterus, your brain should automatically go like how I told you today. Definition, etiology, pathophysiology, clinical features, investigation, management, complication, and a diagram. You won't think, you will execute. That's the difference between a person who scores between 40 to 45 and the person who just pass and the person who is going to get distinction. Prove to yourself that I don't just know the content. I don't know just the content, but I know how to pack it if the examiner gives to give examiner giving you full mark. Like how you tell potato chips, when you buy a local market, you get such a quantity of potato chips at a very less cost. But do you buy that? You go for Lays. Inside Lays, very few Lays chips are there, but they are packing it very superb, isn't it? Attractive, so that you buy it. So that is the way you need to do. So now you have war strategy, which I discussed in the session 1. You have the technique, which I discussed in the session 2. You have the mental resilience I discussed in the session 3. And now I have told you how to execute in your exam in the session 4. Everything from here is repetition and refinement. The difference between you and the topper is not the knowledge. It is about how you are going to execute it under pressure. Start from tomorrow, even if you have not started till now. I have sent you all the timetables in the group. Start now. If you feel alone, add all your friends into the group. The group is anyway open for everyone. Add whoever you want. Prepare together. If you are in the hostel, call all the 50 students, all the 100 students, all your friends to your room. Have a get together. Have a dinner with everyone. So while eating dinner, you tell, now we are going to strictly follow a timetable. Always group study is very important because that gives you a comparison between what you are doing and what they are doing. And that gives you a motivation for each other. You don't have to get demotivated, but try to get motivated with that. And you will be like, stick a timetable in your hostel. In every room, stick this timetable and follow that timetable. If you don't want to follow that exact date, change the exact date, but follow that same timetable. And remember, guys, after completion of all the minor subjects, I'll give you the second phase timetable, the refined timetable, then third phase timetable, reinforced timetable. And I'm going to stay with you guys till you finish your exam. And that is going to be an excellent journey, which I and you guys are going to have. And we are going to meet tomorrow as who knows, maybe any one of you can take psychiatry, and in any of your college, I may join as a SR later after I complete my psychiatry residency, and you may be my PG, who knows, and during that time, you will follow the same unencastic protocols in your life itself. So that is going to be helping you throughout your life. And thank you guys. And in the next session, we will talk about how to manage the actual exam week, like exam week plus sleep, diets, last minute strategy, how to walk through the exam day. We will talk about it in the next session. Okay, guys, I think I have not wasted the 60 minutes, 45 minutes of yours. So I have followed all the real examples. I have given you what are the essays, how to write an essay, everything I have given you guys. So definitely you can follow this. If you follow this, you will definitely get through in your exam with a excellent score. So what I basically want you is had each and every one of you. Why not you? Had 10 friends of yours. Had 10 friends of yours. Inside that group itself, have a mini group. So already 700 students are there in the group. In that 700 students, add one more 10 students each. Add them into the group. 10 we will have. So 10 friends each. So with this 10 friends, again we will build. So that will going to help you so much. So what I basically want you is, if you're going to follow this now, after completing your NEET PG, I can guarantee you that all these 700, 800 students who are there in this group, you will get the mentorship. Those who are interested, we will also start a group for your NEET PG preparations, and we will complete the NEET PG and get the desired rank in your internship itself. At the end of your internship itself, That is my ultimate aim. Our bond does not stop with your final year exams. Our bond will continue till you achieve your desired rank, your desired score, your desired PG branch. With that, thank you guys. Let's see you guys in the next session. Thank you so much. See you all in the next session.